So I'm really pleased to obviously share the impact of the BPSU studies that I've run in the last 40 years. And over the years, there have been studies that looked at metabolic diseases, infectious diseases, even during health emergencies. In these circumstances, we have had studies that have impacted on our health policy, for example, in terms of how we utilize liver centers in the country. Biliary atresia was a good example of that. In terms of patient safety, policy-wise, we have sudden unexpected collapse of babies in postnatal ward, and that's all from a BPSU study. We have studies that have shaped the way we do our national screening, for example, MCAD and congenital hypothyroidism. These are really great examples. And COVID, it goes without saying that BPSU studies were used in shaping the messaging, but also understanding the impact, including the PMTS, which was a really big problem at the time of the pandemic. I could go on and on about studies because there are some infectious disease studies that ran for so many years. HIV was one of the first studies that went on the orange card and helped in the longitudinal study in terms of monitoring, management, and strategy in terms of planning of management of these cases over the time the study ran. I think for an organization that has run a study for 40 years, you do have lessons. So over the 40 years, the key challenge we're facing now is that awareness is waning amongst pediatricians, which is rather surprising because the college on its website describes the BPSU as world leading and as an arm of the college itself. But a recent survey that I did with neonatal trainees, awareness is waning amongst trainees. The other challenge we're facing now is that the number of studies are also down. There was a time we had 10 studies on the orange card. Currently we have 1 study and we're hopefully going to add a few more studies who are coming out, Group B strep, for example, and Lyme's disease. And then the final challenge is that the response rate amongst clinicians is also down. We, in the past, had 95% reporting rate of nothing to report or something to report. Now that's gone down to about 80%. So we want these challenges overcome. But this is going to be through education, which is what we're doing at the college, but also through introduction of this particular mechanism of studies in our curriculum. So we have the START assessment, and we're hoping that we can get into the START assessment for trainees. We have opportunity to increase this pool by using the college's position and policy to help and to advocate for clinicians, everyday clinicians, to be part of this journey, because part of our role is to increase research and understanding of research. There is another gap. I've not mentioned it originally, but we have not translated some of our studies into policy. So we feel from the BPSU now in the next decade that part of our role is to make sure that as the papers are published, the policy about a particular study is already in place so that these patients are often isolated, and I mean isolated because rare disease can be an isolated environment, can feel the benefit of these studies that we do in a very, very positive way. And that's probably the key area that we're facing in the next few years.